If you have your health, you have everything. So goes the saying, and many people are now turning away from drugs and surgeries and looking for alternative ways to improve their health. So Dr. Britton is a doctor at West LA Neuropathy, and he has some ideas on how we may actually do that. Doctor, welcome. Nice to have you with us.
Thank you very much. It's great to be here.
So you're seeing this trend, right? This change of thought.
Yeah. We're seeing a huge trend. And it didn't just start now, but honestly, with obviously the failure of the opioid as a treatment for pain, and also with the failure that got entailed with that, because just imagine if you're a physician who graduated between 2000 before year 2000, 2001, you were raised as a physician in a world that used opioids and a lot of surgery and just drugs. Yeah. And so since the saying would go, where's the pain? Right here, this pain, this drug, then you actually have physicians who, unless they go an interdisciplinary model, are not quite trained to get to the crux or the core of the matter. And I'm not making fun of them. There's too many things to learn in this world for me to know everything, right? But for me to know where this leads off and to be in partnership with another physician who specializes, like our orthopedic surgeon, and our orthopedic surgeon works with patients who maybe, had surgery. Now, after going through all that and the rehab, they're like, you got to find something else. And then he can pass it on to the nurse practitioner who can help them with recovering from the inflammation. Whether we're using a lot of no drugs to be able to get people better, and then go from there to your physical therapy or your chiropractic or whatever have you. That's a different kind of team. And the way of just approaching it, this pain, this drug, it's got to end. It's got to end with compassionate physicians, people talking to the patient, a patient encounter, having 20 or 30 minutes of talk time built in. So that way, how did you feel when you woke up this morning, Mrs. Smith? And then when you got in your car, the pain got worse. Oh, was it the pain from the area that you knew that the disc was blown out, or was it the sciatic pain? It got worse when you're sitting. Oh, well, now we can look at stretches, but we can also look at trying to fix the core of the problem without going to surgery. And what I find is we end up finding things sometimes before they actually evolve into a condition you need to have surgery for. So have you seen people out there that have already tried drugs and either they're on them for life or they're just living with their pain?
Now, you had a personal experience with pain and the way that you fixed it. You didn't fix it yourself, but you thought of it in an alternative way.
I did, but I got really, really lucky. My roommate was a dancer and she danced for Madonna, and she got a doc who'd been one of the people that helped take care of some of their dancers on tour. And this guy had been all around the world already. He's not practicing any longer, but he had 3 different degrees, put together radiology, doing pain management, and he'd even gotten a holistic chiropractic degree. Just try to look at it from the point of view of both the gardener holistically, what are you eating, what are your daily habits, how are you doing with stress, and look at problems from how do we regenerate this stuff, right? Even something, my blood, spun it, it's called PRP nowadays, and he re-injected it as insulation and padding around the nerve and the blood vessels. And guess what? My nerve pain diminished. That's what happened for me.
So let me ask you, doctor, if I go to West LA Neuropathy, what can I expect what kind of service can I expect to get there? What kind of things should I be looking for?
Well, the main service you should expect is a thorough understanding of what your problem is. Is it arthritis, degenerative disc disease? Is it sciatic pain because of the nerve? And then whether it's the orthopedic surgeon, the functional neurologist, the nurse practitioner, the PT, or the chiropractor, you'll be put into the team that can best serve you. And then for some people, they need something like where they need injections or some injection therapy, even anything from hyaluronic acid on up to the things like you mentioned. Or some people need laser therapy to speed up the inflammation and such that their cells can regrow and their body can use its own natural healing process to fix it. The thing you won't that's trying to rush you to cutting you surgery, get you a steroid injection, or prescribe you pain meds. And we're really going to look to see, do we have the MRI, X-ray, nerve conduction tests, and orthopedic exams that justify being able to treat you holistically and without doing drugs or surgery and give you the best service. If we can't, like at this point in the NFL, NBA, like what we're doing is not experimental. It's just that people without access can't afford it. And that's why we're charging only $39 for just for that initial consult. Whereas a lot of people do what we do, they charge like $400.
Yeah.
So you don't know what you're doing. So mostly what you can expect is to not have to risk your pocketbook, find out some good answers. And if you know what, this is really right for you, and you've been dealing with chronic pain, we've got a solution for you, most definitely.
All right, well, thank you very much, Dr. Archione Britton. It's good to have you with us, and I think I'm going to, because I've got a little ache and pain here that I'm going to need, so I will check out West LA Medical and give you a call, and thanks so much for being with us today on the program.
It's been my pleasure. Thanks a lot.